Good morning. Good morning. Happy Wednesday, guys. Who's going to hop on for some coffee talk this morning with me? I am fired up. I was up since 4:15, workout done, shower done, my red light therapy done, my meditation done. Just drinking a cup of coffee, and I wanted to hop on because I read something a couple days ago and doing some research that I really didn't completely agree with. And I fortunately know how to read studies, and I don't always take the headline and just run with it and say, okay, so that's what the headline says, so it must be true. What am I talking about, right? As you can see from the title of this video, I'm talking about supplements. And for those of you that don't know, I am Dr. Renee. I am both an OBGYN and functional medicine doctor with a completely 100% virtual functional medicine consulting business. Good morning, Lorelei. So this is what I do all day long. I do research. I talk about health-related topics. If you're in my private holistic health group, I go over there and talk. Also, Instagram, I talk about different things. So here, today, I'm talking to you guys about supplements because there are two studies that I read that kind of irked me. And for somebody who doesn't know how to read studies that may have seen these, I'm like, oh, and take it for the truth, right? One of the studies was talking about, basically both studies say supplements don't work, okay? One study said that omega-3 fatty acids and vitamin D don't help with inflammation, which we all know that's not true. I do agree with these studies on one aspect, but I'll get to that. The other study grouped a ton of vitamins into one little category and say they just blanket don't work. So here's what I do agree with those studies. Both of the studies, they essentially just gave the subjects the supplements, and if you don't change your diet, of course, or your nutrition, you don't exercise, if you don't change anything else about your lifestyle, but you go and take a supplement and think that that's going to be the magic pill, I agree, it's not going to do anything, okay? So when I have people coming to work with me, they're highly motivated not to just take a supplement if needed. They're highly motivated to change their lifestyle, their nutrition. We do this in bite-sized steps, but nutrition, start exercising if appropriate, start looking at the environment, start looking at the, kinds of food that they're eating, what they're putting on their body. So there's a lot of things that go into it. So I absolutely agree. If we're just going to look at someone taking omega-3s and vitamin D and saying, does it help with inflammation? Well, are they eating crap? Is their diet primarily processed? Are they smoking? Are they drinking? Are they putting a ton of chemicals on their body? How's their environment? Yes, I agree. It will not help with inflammation if you don't adjust for other factors, okay? So that's number one. So, and to lump all of these other supplements together, supplements have different, just like pills in people when they have a diagnosis, in the supplement world, one, you have to be educated on how to use supplements because they can cause toxicity. So that's number one. I do have that education. And number two, not everyone needs every supplement, okay? And if you take this supplement for the intended purpose of what it's supposed to be used for, such as omega-3 fatty acids and vitamin D do help with inflammation. So if someone has a significant amount of inflammation, what am I going to do? I'm going to actually help them with that inflammation and potentially put them on omega-3s and vitamin D. And then the other, the whole other one clumped a ton of other supplements I won't even go through. So that's number one. Number two, I used to have patients come in all the time on a ton of different supplements because a new study would come out that says such and such a supplement helps with such and such. Oh, I must need that supplement. Oh, I must need that supplement. So here they are. They don't even know if they need it or not. Their body needs it. And they're just taking a ton of supplements. So I agree that not everyone needs every supplement. I do believe most people need a few supplements. And I do believe that someone should take supplements based on what their body needs. And what does that look like? Well, that looks like someone coming to me and me doing some specialty testing on them to say, okay, well, this is going on, so this will help. This is going on, so this will help. Okay, so certain supplements, vitamins, minerals will help certain conditions. And I only know that based on testing, right? And so, individualized testing will determine what somebody has to take. So I agree. You do not need every supplement under the sun. Every supplement that comes out with the latest and greatest anti-aging finding, you don't necessarily need, because your levels might be fine depending on your nutrition, what kinds of foods you're eating. And that's why I say most people need supplements, because the quality of our food nowadays, guys, even if you're eating how I recommend eating, which is at least 80% whole foods, at most 20% processed, which I would like the ratio to be greater, but I know we're not all perfect. But our foods, especially if someone's eating 100% processed, there is no nutrient value in those foods. I just was reading the study about the hyperpalatable foods, which I don't know if I'll do a talk on that here or in one of my other two, either my fitness group or my holistic health group. But, there are foods that are manufactured in factories and they're not real foods. So of course they don't have any substantial nutritional value, with the vitamins, except for what's put in there, which is never usually lab, and which is again, artificial. So my take on these studies, if you were just to read the studies, you'd be like, oh, supplements don't work. Not the case, but I do agree they will not work if you think that this is the magic pill. And I tend not to draw people that want the magic pill for a disease or a symptom or a complaint, they don't come see me. They know that when they come see me, they are rock bottom, they're really ready to change. And so we work together to make that change over a period of 6 months, okay? So I agree. You can't just throw on a supplement and expect it to be magic. And number two, I do believe that everyone should take supplements based on their needs, based on what their body needs. And you will not know that unless you work with somebody like me who can tell you that through testing, or ask your doctor to, something as simple as a vitamin D level. Just get your level checked. And again, I won't necessarily agree on the optimal level of vitamin D, because I do not agree that it should be, 30. I believe it should be a little bit higher, but that's my training as a functional medicine doc. So with that being said, guys, there are definitely supplements that I think pretty much everyone should be taking regardless of testing, because most people are deficient, or get specialty testing done so you can determine which ones are right for you, and combine your supplements with a healthy diet, healthy nutrition, mostly whole foods, minimally processed / packaged, because that's what crap is, and move your body whatever way you can, whether that be doing my workout programs with me or taking walks at your lunchtime or whatever. You do those, guys, your supplements will do the intended job that they're supposed to be doing. Okay, guys, happy Wednesday. Cheers if you're drinking coffee with me. And I look forward to bringing you some more live videos on some of the topics that are near and dear to my heart, including supplements. Okay, guys. Oh, and I forgot to mention, I mentioned it to my Instagram family. I had just come off this conference last week and it was super enlightening, and I'm so grateful for everyone I met there, but not only that, everyone here who has watched my evolution over the past 7 years after my back injury, all of the things that I've come up against and how I've come out the other side. And now I've really designed the life of my dreams. I have to say, it hit home last week that this is really my life, and pinch me, it's real, right? And it's November. So what do we do in November? We are more gracious for those in our life, for those things we have, everything. So that being said, and I just mentioned several times in this live video about working with someone like me, I am giving 5 people for the month of November $50 off a 60 to 90 minute consultation with me, whereby you fill out a very detailed questionnaire, and we go through everything with a fine-tooth comb, and I make recommendations. Now, with that being said, it's not the blood work. Unfortunately, that's the larger program, but it will actually give you a kickstart, and I can pretty much suspect a few things that you might need potentially in supplement form. But not only that, guys, there's a lot of things that we can tweak, just me looking at your symptoms and what's going on with you, that you may not know what to do. And I'm here to weed through the scientific evidence and to give you a recommendation as far as how to get healthy naturally. So if you're interested, you will have to fill out an application and to make sure it is a good fit for you, because I certainly, if this is not the kind of consultation that would benefit you, we will find that out in a 10 to 15 minute clarity call. If you're interested in that, I will drop the Lorelai. I will drop the application in the comments below this video. And again, guys, I am only doing 5 for this month. I am grateful for all of you, but the first 5 that get on a call with me and seal the deal are the ones that are going to get it. Okay, guys, I love you. Fill out the application and we'll get the ball rolling. Okay, and get you feeling amazing, or at least on the road to feeling amazing by Christmas time, and definitely by 2020. Okay, guys, love you. I gotta go take Puppy for a walk. We'll talk to you later, and I hope you're staying warm.